Hey, it's Mo Egger. Whether it's pro football or college football, and no matter who you root for, there's no better place to post up for the game than Long Neck Sports Grill. 3 locations in Northern Kentucky, Wilder, Hebron, and Richwood. Each Long Necks has 4K TVs all over the place, and the sound is on for all the big games. They've got an extensive menu. You've got to try Long Neck's wings, and no place in Northern Kentucky or anywhere has a better beer selection. This football season, Long Neck Sports Grill. Stay long. Come often. It's that time of the week again. We talk with one of the experts from OrthoCincy Orthopedics and Sports Medicine. The great thing about OrthoCincy is they have specialist locations and services all over the tri-state. This includes walk-in orthopedic urgent care at 5 locations with extended evening and weekend hours in Edgewood and Anderson. Learn more at orthocincy.com. You never need an appointment. That's orthocincy.com. All right, joining us this week is Dr. Adam Metzler from OrthoCincy. I want to start by talking about Erick All, who showed such promise before he got injured, but he got hurt against the Raiders back on November the 3rd, a non-contact injury, an ACL tear, his second ACL tear within about a year. We've got to keep in mind his injury history because he's had a back issue, now 2 ACL tears. How much does all of that complicate his long-term prognosis?
I'd probably think of these as 2 separate entities, to be honest. I think his back recovery seems to be finished/stable, and they're probably just 2 separate entities. But unfortunately, having a re-injury, re-tear of his previous ACL certainly complicates his pathway in the NFL here. So definitely a challenge for him.
Does the injury history complicate the rehab and recovery following surgery?
Well, this is the same knee that he tore. He was at Iowa. So, yes, I mean, these revision cases are more complicated. They have a longer time frame for return to play. Typically, when we're doing our revision ACLs, we have to harvest tissue from the knee as well. So if he had a previous patella tendon autograft tissue taken, they're going to have to use a quad tendon or vice versa. So there's increased surgical rehabilitation from the complexity of a revision surgery, whether it's an NFL athlete or a high school or college athlete. There's definitely an increased time frame for return to play due to the overall complexity of the surgery and the post-surgical recovery. The latest injury occurred on November the 3rd,
so we're kind of talking about 10 months before the start of next season. Obviously, the timeline is earlier for the start of training camp. Kind of walk me through how much we could anticipate him being on the field for week 1 next season.
Well, he had his previous ACL surgery done in October of 2023, and unfortunately, kind of time frame was pretty darn close to 1 year being out, re-tearing that ACL. So I imagine that he is going to be slow and methodical with his rehab and recovery, as re-tear rates are higher after a secondary ACL surgery than a primary ACL surgery. And my assumption is that he would probably take close to 10 to 12, maybe closer to that 12-month time frame before he is optimized his physical recovery to step on the field. But obviously with each NFL athlete, each game you play, there's a financial compensation for that he's going to try to get back as soon as possible. But now that he's been through this journey twice, my typical track record for this is they're going to take every bit of time they need to feel comfortable and healthy, as we see that more commonly in our professional athletes taking longer periods of time, not necessarily because they can't, but because they want to optimize their body and their physical attributes that they can provide for their team and reduce their risk of further injury. So those things all play a factor into this, but certainly unfortunate for a great young kid doing a fantastic job. And as an alum of Fairfield myself, it's tough to see. So.
Yeah, no question about that. Let me ask you about Charlie Jones. He has missed the last couple of games with a groin injury. How do you typically treat groin injuries?
Yeah, just generically, groin strain is the muscles on the inside of the leg. They help to bring our leg inward, and different grades dictate different type of treatment. So a lower grade strain or a sprain to that muscle can be back quicker, but the bigger sprains or strains there can take a lot longer. But if it's a lower grade strain, obviously we have to reduce the amount of impact in running and let the muscle tendon heal. We're going to do that with anti-inflammatory medications. We're going to do physical therapy. They'll do a topical anti-inflammatory cream, some ultrasound physical therapy, massage, etc., to try to get this to heal and to relax. Initially, you're going to ice pretty religiously, and then as you start to warm up that muscle further in the phase of healing, you'll start using more heat, and you progress from doing limited impact, biking, ellipticals, those type of activities, and then progress to running and then cutting or pivoting. And once we're doing those motions with high velocity and minimal pain, we can start the progression of return to play. Lower grade issues, low grade groin strains, you're talking 2 to 3 weeks. Higher grade may take a couple months, 2 to 3 months to get back on the field.
Want to ask you about Dak Prescott, the Dallas Cowboys quarterback, is having surgery today, or at least it was scheduled. He is dealing with a partial hamstring tendon avulsion. Now, typically we hear hamstring tear, hamstring strain, that sort of thing. I've read that the tendon came partially off the bone. Are these sort of different and maybe extreme ways of just talking about a hamstring tear?
Yeah, I mean, most of the hamstring strains and tears that we hear about in the NFL are mostly muscle issues, so they're within the muscle. These avulsion tears that come off of from the bone up from the pelvis where they attach to, they are a different animal, and they're treated differently. A lower grade partial avulsion, maybe one tendon is treated non-surgically. 2 tendons contemplation for surgery can be had. And then a 3 tendon tear, complete avulsion is generally recommended for surgery and shown to have better outcomes with surgery than without surgery. The hamstrings, your quad muscles have 4. Those are the ones on the front, and your hamstrings are 3. They're on the back of your leg. And so they run all the way across your hip joint, all the way down past your knee joint. And so his injury was more proximal based, meaning towards and off of the pelvis bone. And it's at least severe enough that it's a high grade strain, sprain / tear injury that necessitated surgical intervention. It's hard to get a read on, based on the information available, how severe it is. But obviously with two second opinions or different opinions medically, it sounds like it was bad enough to necessitate surgical intervention.
All right, one more. Let's talk college basketball. I'm a huge UC basketball fan, and I think all of us are kind of, I don't know, apprehensive, nervous. I'm not sure what the right word is. We're not feeling good when 2 games into the season, one of their best players has already gone under the knife. So Dan Skillings, after the first game the next day, was dealing with knee swelling, according to his coach, Wes Miller. They have done a procedure. And nobody is saying that he is going to miss the entire season or anything like that, but the timeline's going to be, it feels like, a couple of weeks. Are we talking meniscus here? What are the range of possibilities we're dealing with?
Yeah, obviously, I don't know exactly all the inside details here, but I'm a huge Bearcat fan myself. I hate to see any injuries. I feel like I already had one ACL injury on their team as their freshman had an ACL surgery already, so we're going to miss him for the season. And now we have one of our premier starters out for some period of time here. It sounds like it's probably a small meniscus tear based on information that's available. And hopefully it's a small flap tear we like to think about. Those do generally well, and usually 3 to 6 weeks back playing. Obviously returning back to high level function. And you know, he's a great rebounder for the team and a great asset and a leader. It may take a little bit longer, but hopefully in 4 to 6 weeks we can see him back on the floor. And obviously the same concept for rehabbing for any other procedures: get the swelling down, get the motion back, get the strength back, and then increase sport-specific activities to where he's comfortably out there without the knee swelling. And that's the to be determined. That is always the uncertainty anytime an athlete undergoes any type of procedure like this. So hopefully we can see him back on the floor. And I think generically the time frame would be for the Xavier game, and that would be great to see. And even if it's limited minutes, it's great to see a leader out there.
No question about that. Awesome stuff as always, Dr. Metzler. Thanks so much.
Yeah, have a great day. Thanks, Daniel.
Most definitely. There you have it, Dr. Adam Metzler from OrthoCincy. I say this every single week because it's true, and I believe it. The great thing about OrthoCincy is they've got specialists and locations all over the tri-state, including walk-in orthopedic urgent care weekdays 9 a.m. to 9 p.m. and on Saturdays 9 a.m. to 1 p.m. at both Edgewood and Anderson. And you can take it from me, okay? My daughter broke her foot about 13 months ago, and with no appointment, we took her right to the Anderson location. My cousin, his little boy, suffered a fall at recess just a week and a half ago. And no prompting, went right to Edgewood. Didn't have to come back and make an appointment. They took him immediately, and they got him taken care of. It's easy because you don't need an appointment, and it's definitely cheaper than going to an ER. Whenever you have an urgent orthopedic injury, go to OrthoCincy.com. That's OrthoCincy.com. Hey, it's Mo Egger. This football season, no matter who you root for, no matter if it's college or pro, you can catch every game at Long Neck Sports Grill. They've got 4K TVs all over the place. And remember, the sound is on for every big game. And if you haven't tried Long Neck's wings, what are you waiting for? There's tons of other great stuff on the menu, and no place in Northern Kentucky has a better beer selection. Locations in Wilder, Richwood, and Hebron. Long Neck Sports Grill. Stay long. Come often.